Today I'd like to discuss an article that just came out on Asian facelifts using the Composite Face Lift Technique. It was an article written by Doctors Wong, Hsieh, and Brian Mendelson. The authors did an interesting study. They looked at what was different anatomically about an Asian face, and they found three things. There was a wider distance between the cheekbones, that there was an abrupt transition from the lateral part of the face to the mid part of the face, and the face was flatter or more retruded in the central part of the face. And they found that because of this, that the traditional facelift that many surgeons use didn't work as well because it exerted pull from in front and behind the ear to try and lift the entire face, and it wasn't as effective when used in Asian patients. Because in a traditional facelift, it's the skin and the muscle just below it that are separated from each other and then pulled and lifted from the ear back. These authors did what's called a composite, where they left the skin and the muscle below it attached. And in this variation, with the two layers staying together, they felt like they had a mechanical advantage for Asian faces because it addressed the middle part of the face, which was so different, better than a traditional facelift. This, therefore, addressed the unique characteristics that Asian faces have versus, let's say, Caucasian faces. What's interesting to note here is that the authors have identified unique characteristics in the Asian face that are different than in a Caucasian face, and then they changed or they modified the technique that we normally use in a facelift to accommodate these unique variations in Asian anatomy. Moreover, it should be noted that due to these characteristics in Asians, there are other what we call ancillary or extra procedures that Asians might have with or without their facelift to enhance the look of their face. For example, things like neurotoxins, which are brand names like Botox or Dysport or other ones, can be used along the jawline or this area which we call the masseter muscle, which can be wide in Asians, and if you inject these neurotoxins, it can help narrow the width of the jawline. Or they may remove fat in the cheeks right along here, which can be prominent in Asians. That's called the buccal fat pad, and that gives the face a more sculpted and less full looking appearance. Now, these things can be done whether they're having this composite facelift or not. They can be done in conjunction or separately. A more profound change in Asian faces can even be done by altering the bony structure of the face. So all of these are other things that can be done with the composite facelift or without it to give a more sculpted appearance to the Asian face. And as in all patients, you can do a facelift and also address hooding, extra skin of the upper eyelids, or puffy, tired lower eyelid that look tired with age, or nasal surgery, or even breast and body surgery can be done alone or in conjunction with this type of a facelift. We truly believe that plastic surgery should be done in the safest manner possible, and this includes the patient being medically healthy and appropriate and screened for the operation they're considering, and having surgery in an accredited operating facility. And finally, I can't underscore the importance of choosing a board-certified plastic surgeon that specializes in cosmetic surgery, because cosmetic surgery is only one small part of what plastic surgeons do. So you want to go to somebody who, they may not only do facelifts, that's very rare, but they specialize in cosmetic surgery as opposed to maybe doing breast cancer reconstruction or pediatric problems. And I know while costs are often a consideration, we have a saying that the least expensive plastic surgery is often the one you do correctly the first time. Lastly, the results of surgery for smoothing out the cheek folds, the jowls, the double chin, or the turkey gobbler in the neck, which facial surgery addresses, can be very gratifying and very long-lasting, and many times you'll only do it once in your life. That is really the gold standard for turning back the hands of time. Thank you very much. I'm Matarasso, talking to you from New York.